certainly a lot of medical testimony in the Dr. Conrad Murray trial, from Murray's use of propofol to how simple it could have been to save Michael Jackson's life. That's what we heard from the doctor on the stand today. Joining us right now is Dr. Christopher Kepekian. He's an anesthesiologist from Glendale Memorial Hospital. And doctor, thank you, first of all, for coming in.
Thank you.
You may have heard Dr. Schaefer testify. Something as simple as a chin lift could have saved Michael Jackson's life. Apparently his tongue had blocked his airway, and something as simple as readjusting. That seems like Doctor 101.
Absolutely. That's pretty much the first thing that I was taught during anesthesia. When you have a patient that is not breathing, you gently lift the jaw, and that would relieve that tongue off of the back of the throat, and then you'll be able to breathe.
You know, we've also heard that there was a good deal of time before the doctor had someone, or the doctor called 911 to tell them what was going on. There's also been testimony in the trial that, in fact, that's pretty much the first thing a med student learns, that you need help if you're trying to resuscitate someone. Absolutely,
because every minute that passes, your chance of survival decreases by about 10%. Therefore, the faster you get help, the faster you're able to get resuscitative measures in place, including help, because you cannot do everything yourself.
Let's talk a little bit about propofol.
Strong
I bet you've answered a lot of questions about that in the past couple of years, haven't you?
Have I?
What are people saying to you when they come in for surgery? Are they aware of this? Do they ask about it? Are there concerns about it?
You know, there's a lot of concern, obviously, because of the situation that has happened. Propofol is a very good medication if it's given in a monitored environment. It's a hypnotic. However, it has a side effect which basically renders you non-breathing within minutes.
Have you ever heard of it being used in a home?
Never.
I understand it's not unusual when you're administering propofol for someone to stop breathing. Is that the case in a controlled situation?
In a controlled situation, sometimes you do want the patient to stop breathing, such as times where you're going to be intubating the patient, where basically breathing tube being put down before surgery starts. Sometimes it's used as a sedation medication, like colonoscopy or endoscopy, where the patient is actually breathing, but it's in hypnosis. Now, during that time, the patient is not aware of what's going on. However, at the same time, they're breathing, oxygenating, and that's what's important. However, if you don't know how much you're giving, the patient can become basically not breathing, and this can result.
That speaks to the issue of records. We heard the doctor today talk about there were no records kept on how much propofol, there was no measuring device. Do you find that a little unusual? I mean, do you keep records when you're in an operating situation and you're administering propofol? How imperative is it to keep records?
It's incredible when I hear that there's no records being kept, there's no monitoring, especially when the patient's well, you can give such medications as Versed or Ativan, I think that was used by the patient himself. But however, if you're giving it in a setting where there's propofol, you should keep records. That's one. Secondly, you should be monitoring the patient at all times. You cannot just leave a patient at all when you're giving propofol.
So when the doctor says, I had to run outside for 2 minutes to use the facilities,
it's not allowable.
One of the other things that Dr. Schaefer said today, and I've got to read this because it's so interesting, they're talking about using propofol every night for 2 months to help Michael Jackson sleep. He said, we are in never land here in terms of an area when you're discussing propofol and pharmacy prescribed drugs. Would you agree with that?
No. I'm not exactly sure how he was able to obtain propofol, because propofol usually is used in hospitals or surgery center settings. However, being able to pick up that medication and take it to a home and administer it there, I'm not exactly sure how he can do that.
Physicians always put patients first, correct? I mean,
Absolutely.
Isn't that sort of the code?
Absolutely.
do you think propofol has really been given something of a bad reputation? I mean, do you have patients who come into you now and say, I don't want it under any circumstance?
That has come up in the past. However, the main thing is that propofol is an incredibly very good medication. I cannot, if I can have propofol alone, I can do surgery, meaning I can give anesthesia for surgery to be done. However, if it's not used correctly, obviously it's deadly. And that should be, the patient should be monitored at all times. Okay. Make sure that the patient's breathing, adequately oxygenating. If they're not, obviously specific measures has to be taken.
Do you think physicians are watching this trial very closely, given the dynamics going on here?
They're watching closely, but I'm sure that they're frustrated as anesthesiologists. I mean, we, you know, it's not a joke what we do. It is day in and day out. We're put in situations where we have to keep the patient in a sedated, in a conscious, non-conscious state, and surgery is being done. Patient comes out not remembering anything. I mean, it's incredible that what we can do as anesthesiologists. However, I'm sure that every anesthesiologist is watching this and they hear that propofol is being given in a non-monitored environment. I'm sure they're very frustrated, as we saw today in court.
Doctor, thank you very much. Appreciate you coming in.